Good afternoon. As Dr. Young-Fadok said, I am the ERAS data coordinator here at Mayo Clinic, Arizona. And today I'm going to be talking to you about preoperative patient education, but more specifically, preoperative ERAS patient education. I have no disclosures other than I am a data coordinator, and I do see all that happens with ERAS. And that's where I'll start that. So why do we need ERAS-specific patient education? As a whole, ERAS is still relatively new. The first kind of round of consortium guidelines were published in 2013, and with the updated colorectal and gynecology guidelines in 2018 and 2019, there was a stronger recommendation and stronger level of evidence for preoperative education. And so the U.S. medical community, since ERAS is still relatively new, has essentially just begun catching on to what ERAS is. And so it's our job to inform the patients about these waves of changes that are coming, changing the dogma and preconceived notions of what surgery and recovery looks like, as well as setting their expectations appropriately and reducing any existing preoperative anxiety. So in terms of changing dogma and preconceived notions, ERAS patients in colorectal, it's not all across the board that they're getting bowel prep anymore. It's selective and includes the addition of oral antibiotics, which is not something that's traditionally done. There have been multiple randomized controlled trials on the safety of clear liquids 2 hours preoperatively, something that's been stated a couple times today, but I did want to iterate that the American Society of Anesthesiologists established this guidelines over 20 years ago, and that's still not a common practice today. So, and again, with today's climate on pain control and the opiate crisis, patients want to know about safe pain control and the other options that they have. Early feeding and early mobilization are also significant ERAS changes that the patients need to be educated on. And all of these practices, whether ERAS or not, are different across institutions, across departments, and can be different across providers within the same department. So how do we deliver this information? Our colleagues at Atrium have developed they utilize a multi-patient class that educates their patients. It's very comprehensive. And here at Mayo Clinic, we have an enhanced recovery